Thank you for taking the time to learn more about Sabino Recovery. Sabino Recovery is here to address primary treatment for those suffering the effects of trauma. Current research has proven that widespread behavioral issues such as addiction, depression, PTSD, and substance abuse are often created and shaped by unresolved trauma. Our goal is to have residents spend 35 days in our healing environment to resolve their core trauma so they can transition to the next phase of their recovery. What is trauma? The American Psychological Association defines trauma as the emotional response to an extremely negative event. PTSD, addictions, anxiety, and depression are normal responses to horrific events. And trauma is everywhere. It can be a single life-shattering event, or it can happen slowly over time as a series of severe, painful, repeated events. These can include sexual trauma and abuse, childhood trauma such as sexual, physical, and verbal abuse, abandonment and neglect, betrayal, PTSD such as combat or sudden death, especially if witnessed, and attachment failure. Traumatic events can trigger many symptoms that take the form of self-harm, including addiction. Treating the core issue that is causing these symptoms will often lift the veil of depression and anxiety and provide a clear pathway for residents to do the significant and lengthy work of sobriety. And we've seen that once people heal from trauma, it becomes easier for them to resolve their other issues. The Sabino Model. Our model is based on 3 equally balanced tenets: emotional and physical safety, neuroplasticity, integrated and individually tailored treatment plans, safety. Here at Sabino Recovery, we are committed to providing a place of trust and safety for the restoration of hope and healing of our residents. We've created an environment that is so safe and nurturing, patients finally have the support they need to take that critical first step to face their trauma. Neuroplasticity. The Sabino model is based on the latest neuroscience research in neuroplasticity. Neuroplasticity is defined as the brain's ability to change itself in a positive way if exposed to positive experiences. Every modality and practice we put into place is chosen for its ability to impact the brain to create new neural pathways which drive healthy behaviors, thoughts, and emotions and create lasting change. Integrated and individually tailored treatment plans. Every aspect of treatment is customized to provide the best, most effective care possible. Our assessment process produces a very carefully crafted, comprehensive, and highly integrated treatment plan, which determines what therapies, modalities, and activities are best suited to each individual. And each week, the treatment team meets to discuss residents' individual progress, updating the plan as needed to specifically address their changing needs. The Sabino model includes traditional modalities found at inpatient rehab centers, such as psychiatry, psychotherapy, somatic experience, and EMDR. But the difference here is that we offer an equally comprehensive program of holistic therapies not offered at most treatment centers, such as outdoor and adventure therapies, massage, acupuncture, meditation, and yoga. A balanced naturopathic and allopathic medical approach. By utilizing both naturopathic medicine and allopathic or Western medicine, we can balance individual programs at an optimal level. Our medical director is a naturopath, and nutraceuticals are promoted and provided. We also employ allopathic providers that include a psychiatrist, a psychiatric nurse practitioner, and a psychologist. How to help. Many people, when asked directly, don't recognize or cannot articulate that they have experienced trauma. Here are some indicators of the presence of trauma which often interferes with sobriety. multiple relapses, difficulty with daily life or unable to function, difficulty with emotional regulation and/or lacking in coping skills, detached and isolated, severe, intense anxiety that is disrupting daily living, intrusive memories from a traumatic event, nightmarish flashbacks. When you recognize these symptoms and believe that specialized trauma care is necessary, please give us a call. Then together we can create another success story.